Hey guys, it's Hink here. So today we have a really important topic that I think could potentially unlock the potential for even more significant like penile lengthening gains. And it's that of vibration therapy. We need to talk about its application and its actually utility. So stay tuned. Guys, let's just dive right into it. So the first paper we're going to look at is looking at whole body vibrations in actually diabetic patients. What they looked at was, does it actually increase nitric oxide levels and therefore blood flow levels? And guys, it does. As you can see in this paper, the low amp vibration therapy actually increased skin blood flow, and that was thought largely to be to increasing nitric oxide. For those that don't know, guys, nitric oxide is the key to like basically blood vessel dilation and getting healthy blood flow, whether it be in your penis or whether it be elsewhere. All right, so there we have a more like general understanding, but is there actually evidence of actually improving actual penile health? And guys, yes, there is. There's this device. I don't really want to say the name just because I don't want to give out like free promo and I don't necessarily believe in the device. But basically they had a case series looking at basically validating this, and it's basically a vibrating ring that goes along the base of the penis and actually onto the perineum, like the taint, if you will, as well. What they found that using 8 weeks of this device actually led to improved erectile function long term. And this used specifically like intervals of 10 seconds of vibration and then 10 seconds off in kind of a pulsatile manner. But guys, it did improve erection outcome. Now that being said, this was a sponsored trial, so you got to keep that in mind. Now, specifically, once again, vibration does help. Usually this is in the form of more like sexual satisfaction, but even in guys with like true spinal cord injuries that especially that have some erectile dysfunction from this, the use of vibration actually improved rates of anorgasmia. So it led to the ability to have increased quality sexual intercourse. Okay. Now we're going to start breaking down some of the more like science behind like how this could actually be applied to penile enlargement. So this first paper we're going to look at was actually published in 1988. So old data, but it actually showed that when you had 4-hour sessions of vibration exposed, now this is specifically looking at tendons, that they actually increased IGF-1. Guys, I made an entire video on IGF-1 and basically growth hormone and its potential application in PE. Specifically, you guys should watch that video after this one and actually take a deep dive into IGF-1. But IGF-1 can actually improve collagen synthesis. So long story short, guys, the tunica albuginea is like this rough sheet in the penis that actually is responsible for the rigidity of the erection. And it's actually the rate limiting step as far as penile expansion and growth. And it's composed of collagens, mainly type 1, 3, and 4. In theory, if you could increase collagen synthesis, that would potentially allow for more stretching, more dilation, and more growth of the tunica. And that's proven in this paper here as far as its effect on collagen synthesis. But guys, here's another study that actually looked at the role of vibrations on actually rat Achilles tendons, okay? And what they found was that using basically a 2G 25 hertz vibration treatment for 12 weeks had no effect whatsoever on the tendon, okay? So this is essentially a negative study saying that, vibration's a bunch of crap. But guys, here's where things start to get a little interesting, okay? Damn, my forearm's looking beefy right there. Okay, Hink. But this paper here looked at 20 minutes of 0.3 G vibration, and it actually found that if you're looking at tendon cross-sectional area, it actually increased tendon stiffness, guys. So it actually increased stiffness. So here's a quote. These initial findings suggest that vibration may serve as an anabolic stimulus to the tendon, similar to its effects on bone and muscle. These findings are important as they open the potential that low magnitude, high frequency vibration might serve as a means to accelerate tendon healing. So guys, the key thing is that if you're increasing stiffness, that's the opposite of what we want. We want our tunica to be able to basically dilate and expand and then heal afterwards, but essentially heal after it's already been elongated. So if you are increasing that stiffness, it's going to be less resistant to stretch. And guys, here's another paper here. Now this was looking at specifically, once again, like rat Achilles tendons basically, but it actually looked at TGF beta 1 or transforming growth factor beta 1 and how that actually mediates this type 1 collagen response. You can see here in these graphs is that they actually, with the vibration stimulus, you actually had increased rates of basically collagen deposition. And you can see here in this little figure they have here is that the way that they were able to basically take the rat Achilles cells and expose them to that vibration, and what it does as far as upregulating the TGF beta 1 and increasing the type 1 collagen, once again, guys, increasing tendon stiffness. Now in this article, they're arguing that tendon stiffness is a good thing to prevent further rupture, but in my opinion, tendon stiffness is a bad thing if we're talking about increased collagen stiffness and we are trying to actually dilate tunica. Once again, I always like to give credit where credit credit is due. And there's this dude Simtex on Reddit that, you know, I've been cool, well, at least I think we've been cool for many, many years now. And he really brings up a lot of good data and a lot of good points. And he actually made this post here because there's this new product out. I'm not going to talk about it in this video, but it is coming, guys. I'll make my thoughts on it known. But it was largely based on the use of vibration therapy, and he linked 2 studies. And one of these studies is like really, really good. And I actually wanted to break it down more. And so the name of the study is actually Varying Whole Body Vibration Amplitude Differentially Affects Tendons and Ligament Structures and Material Properties. Basically what they do is that they had these rats and they vibrated them at 20 minutes per day, 5 days a week for 5 weeks, sacrificed them, and then evaluated different tendons and ligaments in their body. And they had the no vibration group, a low vibration, and a high vibration group, all done at 30 hertz amplified sine wave signal, okay, for actually measuring like what kind of vibration status. There's a couple important conclusions that what they saw. Number one is it actually led to some collagen disorganization, okay? So normally your collagen fibers are aligned, and then by exposing them to that vibration, it can actually cause the fibers to become unaligned, if you will, and that in theory could potentially predispose them to more growth. And now anti-lock slightly works in a slightly different way, but if you haven't seen my videos on anti-lysyl oxidase, but how it actually is able to basically break down those collagen bonds and allow the tissue to actually expand, and you can have major penile growth as a result. But this in theory could do something slightly similar by disorganizing the collagen. And you can see that in this figure here between A being no vibration, B, and C. If you look at C, the fibers are completely like out of line, guys, or I mean, relative to the control rates. They saw that high vibration caused an increase in collagen expression and increased IGF-1 expression. We already talked about how IGF-1 can lead to higher rates of collagen synthesis. They also saw that hypercellularity was seen, as well as these big, juicy, what we call fibroblasts, guys. Fibroblasts are typically what's involved in the production of actual collagen and collagen synthesis. So essentially by up-regulating those, you put them in a more active state, and so you're going to have more collagen deposition. And here you can see in this table 4 here, the actual rates of actually fibroblast counts that you can see, whether it be in the control, low or high vibration in either the patellar tendon or in the MCL. Basically what they concluded from this is that using higher vibration, it led to the hypercellularity of the fibroblast, so upregulation of the fibroblast, increased collagen expression, and a trend for an increase in IGF-1. And they argue this demonstrated anabolic effects. Now, guys, once again, a key thing is that if we are stimulating more collagen and therefore the collagen is getting thicker, that is going to be harder to distend. You don't want a thickened tunica. You don't want hypercellularity from collagen production. I would argue that this is actually further evidence that maybe we should not be exposing the tissue. Now, the collagen disorganization, like, yeah, I kind of see how that makes sense, but upregulating collagen is not necessarily what we want, especially when there's a lot of these different studies showing that it actually increases stiffness, which will essentially make it harder for us to do lengthening exercises and girth expanding exercises. Briefly, I wanted to touch on basically massage guns, percussion guns, okay? Because there was at least a trend on getting bigger for a while that everybody wanted to use massage guns. I'm not going to waste much time on it here, but guys, here's a couple papers here. Here's one paper here that showed that there was improved calf muscle range of motion or stretch, but that was thought for the actual muscle relaxation, not actually tendon relaxation. And here's a study that actually showed that there was some mild improvements in the bench press. But once again, guys, this is skeletal muscle and the data is actually pretty crap. And there's actually a big review study here that actually showed that, yeah, massage guns can actually help to improve short-term range of motion, flexibility, and recovery-related outcomes, but there's no other strength, balance, acceleration, agility, or any other benefits, guys. And so a massage gun can actually be pretty rough on your jimmy as well, depending on kind of what strength and, you know, how hard you're pressing on it. So I would argue it actually puts you at risk of injury. Here's a pretty important paper here. This is a case study where actually a massage gun was used on the muscle, and it actually caused the muscle to break down and release a bunch of electrolytes into the bloodstream in a potentially life-threatening condition called rhabdomyolysis. Don't just use this stuff all willy-nilly. And yeah, guys, I'm old, so I can say the term willy-nilly. And I've read some stuff here and there about using massage guns for like lymphatic issues. Please don't do that. It's going to make it worse. So guys, what are my conclusions? Well, guys, once again, you see how I break down the data. If you're interested in learning how to do enlargement in an actual science-based, safe manner, my course is available online in the description. But guys, there's a lot of unknowns about vibration. Most of the evidence that I see is it actually leads to increased stiffness when it's talking about tendons and ligaments. There has not been a randomized controlled trial looking at vibrations on your penis versus not and whether that can help. I personally think that it's not going to make much of a difference. I don't. I do think that when you're talking about things like girth work, where you are already in an erect state and you want to maximize erection quality, using things like a vibrating device can make the session more pleasurable, but it can also lead to improvements in erection quality, which could, in theory, help. But that's more by stimulating more of the nerves in that area and stimulating more of the blood flow, kind of like that paper we talked about earlier as far as erectile improvement, not necessarily by its like physiologic actions as far as the actual like collagen in the tunica. And I also think you need to be very careful with the strength and the force of the vibration device that you're using depending on what you use, because guys, penile enlargement, it's dangerous enough as it is. By adding even more things like, okay, I'm going to be aggressive. I want to use heat and I want to use vibration and I want to use all this stuff and I want to pump and clamp and pull. That's dangerous, guys. Let me know. What do you think? Do you think vibration helps? It'll be interesting to see if this, device that's coming out that claims these absolutely insane gains, which I don't want to be a hater, but I think is kind of bullshit. But, we'll see. I'd love to be proved wrong. And, maybe I'll buy one of those $20,000 devices. But as far as the literature, how I review it, I don't see a role of vibration right now. I'd love to be proved wrong. These are just my thoughts, guys. Anyways, I'll catch you guys on the next one. Remember, there's nothing wrong with self-improvement, but you are enough just as you are. All right, guys. Peace and love.
Dr. Hink got the plug on the health, yeah. Got you thinking about your wealth, yeah. In his office.